Okay, guys, super excited today. Got a very special guest. In regards to any of the courses that we've put together, there's basically two people's names that you'll see referenced throughout all of our courses. A lot of them. One would be Lenny Kravitz, obviously pseudonym of the famous artist, and the other one is Dr. Stuart McGill. I'm not sure if you're aware, but you also got another namesake here in Australia who is or was a famous cricketer, also called Stuart McGill. So every time I reference your work, I always think of him as well. But I'd like to thank you very much for being here today with us. For those of you who are unfamiliar with Dr. McGill's work, expert in back health, core strength, all of these sort of things. If you go to the BackFit Pro website, that's where you can find him. If you go there, you can actually download his resume, and which I did, and I think it was like 35 plus pages long, which gives you an idea of the extensive career this man has had. So it's a real pleasure to have him here today. So thank you very much for joining us, Mr. Dr. Stuart McGill.
Oh, well, good morning, Travis. I guess it's morning for you. It's evening for us. Thank you very much for the introduction and for all the work you do as well.
Well, thank you. Thank you. Now, for those people who may be listening or watching, if they're maybe unfamiliar with your work or who you are, would you like to give them a little bit of a rundown potentially, and so they can find you and know a little bit more about you?
Well, I was a professor for over 30 years at the University of Waterloo. I'm now what they call Professor Emeritus. We developed two different laboratories while I was there. The first one was an in vitro laboratory where we took real spines and created the injuries. So we learned what motions, postures, loads, repetitions, etc., created very specific types of situations like end plate fractures and Small's nodes and torn ligaments and different types and subcategories of disc bulges and nerve compressions, etc., etc., etc. The second laboratory was an in vivo laboratory where we measured live people, very difficult, challenging back pained people through to top athletes. And we measured their motor patterns through electromyography. We quite often built a virtual spine of them with three-dimensional imaging, be it MRI or CT based. And then we built a virtual spine to calculate the internal load distribution of the stresses within their bodies when they did certain things. So we got to assess the wisdom of certain types of motor programs, and we saw things like, well, stability, for example, is an often talked about concept, but very poorly defined. And I will say sometimes well used and sometimes terribly abused. But we quantified stability and got a sense of why it's important or maybe not important in the spectrum with mobility, etc. And the third part of our story at the laboratory was I started a research clinic for people with back pain. And when I first started it, you might find this interesting, I set up 2-hour appointments. And my colleague said, "You're crazy, spending 2 hours with a patient?" And I said, "Well, I don't know any other way. We need to listen to them to tell their stories so that we understand what the impediments were as to why all the other medical interventions failed. We have to be the ones to make a difference. So we need to know their stories." And would you believe it? After about a year, I switched that to a 3-hour appointment. We found that it was that lengthy to really understand why that person had pain, and it quite often was a full spectrum of mechanical issues, anatomical issues, neurological issues, quite often a little bit of psychological overlay. You know, if you can't sleep with chronic back pain, that's the definition of torture, being sleep deprived and low-grade chronic pain. So no wonder people lost their constitutions and wills. But what we found was if we addressed the cause of their pain, quite often the psychological cleaned up on their own as people regained their sleep back. You know, as a new father, probably what I'm talking about.
Yes,
But
yes.
anyway, is the sound okay,
Yeah, we
Travis?
sound great. We sound great. On my end, it does. So hopefully on
Okay,
your end.
fabulous. Yeah, I'm using a studio mic today,
No,
so
it's all good.
hopefully
It's all good.
it's getting through the ether all the way to
No,
Australia.
it is perfect over here. Now, I just want to touch on that because it's so interesting. I've got a brother who's like a medical doctor. He's a sports medicine doctor, and it's interesting you saying like we needed. I wanted to do 2 hours with these people, and everyone thought I was crazy. And then all of a sudden, you're now going. I need to do 3 hours with these people. And I chat to my brother, and like when he's churning over through people, it's like 15-minute appointments, 20 minutes appointments, and you're like, how deep are you going to get into any of these potential problems with a 15-minute appointment? You barely, especially if you've never met the person before, like you don't know anything about their background, you don't know anything about their history. So that's a really interesting take on it, and I think it's a necessary take on it as well.
Well, it requires a totally different shift in philosophy. Uh, Governments, insurance groups pay for procedures to be performed. So a doc will get X amount of money to perform a procedure, but just a minute. Where in the system is someone performing an assessment? Because there's no such thing as non-specific generic back pain where you try doing an injection or you try doing a surgery or you try doing some kind of a modality, you try a certain exercise. My goodness, would you do that with non-specific leg pain? No, of course not. You would assess the leg and figure out whether it's got torn knee ligaments, contusion, or a muscle tear, or you name it. Well, this is what is missing with back pain. So it took us 3 hours to do a very thorough assessment to arrive at a precise understanding of the mechanism of why that person was failing and was left to languish in pain. So we were not paid to perform procedures. We charged for our time and produced almost all of the time, but not always, a precise explanation for the patient of what is causing their pain and then what they must do to stop the cause, which is the first item, and then what they must do to build a foundation for pain-free activity. Now, that definition of pain-free activity is very different from your mother versus you versus your child.
Yeah. Now, this shows you where I got leveled in. I've got three other brothers, right, where I got leveled in the brain's capacity. I've got one who's the sports medicine doctor. I've got another one who's an orthopod, right? And so his thing would be, let's operate on people. Let's operate. So in saying that, it all ties in really well together. I'd be interested to know. I don't know if you've got this offhand. How many of your people that you've worked with, when you've been able to spend those 2-3 hours with them, still ended up having to go like a surgery route to improve any of their symptoms? Just curiously, if you know.
I know those numbers exactly. We were one of the few groups ever in medical history to follow up with every single patient we ever saw at the university. So we know what they came in with, their subcategory, whether they complied or not, whether they got better or not. Now, here's one statistic that I can stand by. Of all of those patients who came who were told, you've tried chiropractic, physical therapy, yoga, strengthening and exercise, it's all failed. The only thing left for you is surgery. Of those people who were told all they have left is surgery, we got 95% of them to avoid surgery. Now, having said that, there are those who do very well with surgery. They have been damaged. A surgeon's scalpel and skill is required to set the anatomy back to a pain-free, stable, load-bearing system. But if a person has a disc bulge that is frictioning a nerve root, what caused the disc bulge in the first place? Most of the time it was crossing the tipping point in terms of load and motion, etc. And when those are avoided, quite often with appropriate exercise, the disc bulge can be vacuumed in and it resolves. Interestingly enough, when you look at the studies of people who form homogeneous patient groups, those who have surgery are pretty much identical to those who didn't after 10 years.
No. Yeah.
But I'm not, you know, there are some nasty situations we see. You know,
Of
we'll get
course.
people with, say, a Tarloff cyst on a nerve root. That the only thing I know of is a surgical intervention for that. So thank goodness we
Oh
have
yeah.
brilliant surgeons. We absolutely need them. However, just because someone has a very acute disc bulge, they're absolutely locked up in very acute pain, it's no rationale to send them off for surgery. The vast majority of them, if their mechanism is well understood and defined, it can be dealt with without surgery.
Okay. Good
So
to
that, you know, there's both sides of the coin on that one.
Awesome. Now, I know from looking at some of your papers that you did work with power lifters. I'm assuming in those obviously in vivo studies. Um, Now, that's a fairly extreme group of people to be working with when they're looking at, heavy load squats, heavy load deadlifts. I'm not sure. I don't think bench press would put a huge load through the spine as such, but at least the squats and deadlifts, the load and the shear force going through the spine, that's a interesting cohort to take on. And
Well, yeah,
yeah,
in fact, we've studied many different types of athletes. Powerlifters are on one end of the spectrum.
mhm,
They must, by definition, be very stiff because we live in an articulated linkage of our skeleton and our body. And you can't crush an articulated linkage under a car. It will crush unless it's stiffened. So the powerlifters obviously adapt stiffness through their body, which, you know, they have difficulty scratching their ear. Their arms and shoulders are so stiff, but they can bench press, you know, 400 kilos and deadlift 500 and 600 kilos. And by the way, if you go to our website, you'll see that we've restored the careers of many record-setting athletes. Yet on the other end of the spectrum, we also deal with athletes who are highly elastic and attuned stiffness. Think of a javelin thrower, a dancer, an MMA fighter. Uh, uh, Gosh, we even did a cohort study on Middle Eastern belly dancers. We've dealt with yoga groups and occupational groups, firefighters and police officers, etc. So, isn't it interesting that athletic performance is quite specific? So a power lifter won't do well in a yoga class, and a yoga master will get absolutely crushed if they get underneath a car. So what these people have done is tuned their bodies to become rather unidimensional in what they do at the expense of other abilities. And then, you know, we see people like CrossFit, for example, where they need this enormous spectrum of athletic ability. But here's the thing: when we train, we create adaptations. And those adaptations are often in competition with one another. Think of training an MMA fighter who must be explosive to get up off their back and back into standing position and all that, extremely explosive. And yet they have to last 5 minutes times five in a championship round, which is enormous endurance. Well, as you know, when you train endurance, it's at the sacrifice of your fast twitch explosive metabolism. You can only have it one way. So this is the great challenge with, say, an athlete like a CrossFit athlete that needs it all. And the challenge for us is to balance and manage the trade-offs. So they can't be extremely strong. They can't do 10 Olympic snatches and keep good form without getting tired within that power, endurance, preservation of form spectrum. Something will give if they push it past the biological tipping point. But this is the great challenge in what we all do. So I guess my response in that was, it's a bit of a myth. Some people think we've worked exclusively with powerlifters, not realizing that we deal with the full spectrum of athletics. But what allows us to do that is the appreciation of the great trade-offs that are made, because biology won't allow you to have it all. And now you have to create a training system that stays below the tipping point so you have positive adaptations and not go to injury.
Yeah. I mean, for me, I just know, I've seen like a range of stuff. I just think when you're thinking about people with bad backs, bad hips, doesn't get much worse than powerlifters in regards to like hip replacements and all these sort of things that they've gone through. Like, it's just, when you're talking about those sort of things, I just think it's like the epicenter. And I mean, maybe CrossFit's not far behind these days, but you know, like, I think that's the epicenter of potentially bad backs right there. And I mean, which leads me to another question. This is sort of off a little bit from the powerlifting realm. Are you familiar with like the reverse hyper machine and stuff like that?
Of course.
Yeah, and Jefferson curls. I'd be interested to hear even like thoughts on those sort of things, because they're fairly, especially Jefferson curl, where you're sort of really like getting that bend through the spine under load. I'd be interested to hear your general thoughts on that.
Well, of course. We can't discuss any of those exercise modalities or approaches until we have the person in front of us. Sometimes it might be very appropriate. Sometimes it would be the kiss of death. So an assessment of the individual will reveal what the specific pain triggers are. Now, if they have delaminated collagen in the posterior part of their disc, so that if they sat for an hour at the computer and their legs started to fall asleep, I would suggest don't do a Jefferson curl. That would not make sense. I would also say that when you have heavy load, that would not be a wise thing to do. However, if you're a gymnast and you're using a very light load, see, gymnasts as a rule don't use heavy weights. They use body weight and they control body weight. So there has been some gymnasts and gymnastic programs that use the Jefferson curl with lighter weights. Fair enough. They're staying below the tipping point, not crossing it. However, some kid viewing this on social media might think that's a good thing to do, not realizing that that gymnast has adapted their elasticity and toughness in their back for years. And yet they will then go and do a Jefferson curl with a weight and wonder why they've woken up with a hot disc. So every exercise modality is a tool. I mean, we could have a discussion about the Palloff press. You know, there's one that creates a very high shear load. If the person showed that doing a shear provocation of their back triggered their symptoms, that would be very silly for them to start a progression, say, with front planks and side planks, and then stand up and do a Palloff press. That is a cantilever load, where a side plank is a 3-point bend. They would be much wiser with that injury history to go to an upright unilateral carry, perhaps a suitcase carry, and then going on to farmer's walks. And they will be a much better athlete than potentially triggering that pain generation with a Palloff press. But then the next person is very shear stable, and it might be very appropriate. So I'm not avoiding the question at all.
No. It's
hard,
hard, obviously, to answer these questions because it's so individual, and
exactly
that's what we're getting out of it. I mean,
yeah,
which would lead me to the next one. Like, as a normal personal trainer, again, you may not have a direct answer for this one. Where's that line of like someone who says this is uncomfortable? Or like, obviously if they're going, oh, this hurts, this is pain, that's obviously a no-go. But is there a particular like line as a personal trainer that you skirt in regards to something like a Palloff press where you want to develop some of that strength? Or is it just, if it hurts that particular person, just make it a no-go and go towards those farmers carries?
No, you've hit on the crux of it. That's an enormous question. And now it gets down to what I call the art and science and mastery of the craft. So, you know, you'll go to an old wise fight coach, and I just think of the old coach in the Rocky movies. Just a great amount of wisdom there, and they knew the difference between muscle fatigue and that sort of pain and discomfort versus real tissue, discogenic, nerve, bone, fascial pain. So there is a real difference there. And part of that art and science is knowing the tipping point. So as I mentioned earlier, load is a combination of the magnitude of the load, the number of times it's repeated, the duration over which it's applied, but it's all mitigated by rest. So now I'm going to give you an example of a power lifter. Well, let's start with a bodybuilder who their job is to hypertrophy muscle. It's not to get strong, it's to hypertrophy muscle.
Right.
Now, of course, they get strong as they go along. But sometimes they want to switch to their career out of bodybuilding, and now they want to get strong and become a power lifter, which it doesn't matter what you look like. You just have to be strong to move the weight. And then all of a sudden they get injured and in trouble because we train not to get strong while we're doing the training. We do the training to stimulate the adaptation when we're resting and fueling afterwards. So a bodybuilder will stimulate their muscle, actually break it down so it adapts to a stronger, bigger muscle. That's typically a 2 or 3 day turnover rate. But now let's take the power lifter. When you examine the training regimens of the successful grand old men and women of powerlifting, many people consider them undertrained, but they don't realize what they're doing. They'll do heavy squats and then take 5 days off before they do a very heavy squat session again. And what they did was, when you put the spine under that kind of load, it's the trabeculae bone inside the vertebral bodies that are the tissues probably closest to the tipping point. In fact, they will actually microfracture a few of them. Well, if you train like a bodybuilder, that microfracturing builds up until they get a Schmorl's node, which is a blowout of the bone and cartilage on the M plate. Then they get a flattened disc, and then the whole cascade starts. They've got micro movements at the joint and chronic back pain, and they can't even sit at the computer for 20 minutes. They think it's so unfair. They were getting stronger. But my point was they allowed the microfracturing to accumulate by training day after day heavy lifts. But had they been more wise in their programming, train heavy and then take 5 days off, the bones would have actually calloused around the microfractures. Now that's called sclerotic bone. So if you ask your brothers, what's sclerotic bone? And they might say, oh, well, that's a disease and something that a radiologist might remark on. Me and you would say, we call that adaptation. So when you look at a power lifter, they've got heavy bone sclerosis across the M plates. Those are bone calluses from repeated microfractures that stayed below the tipping point, and they allowed optimal adaptation. So do you see how the art and science, now they can't train elasticity in big ranges of motion and still create the adaptations they need to get the sclerotic bone. But as a power lifter, as you know, you want to be in elastic stress when you're picking up the bar. It should be a stretch to get there, because if your hamstrings aren't on full stretch, they're not on full strength.
Yeah,
exactly. So this is the enormity of the challenge, and it does require a mastery of the craft, and that's what we try and get across in our courses, is the understanding of the mechanisms of adaptation and how we recognize each of the requirements to be pain-free, and then we can understand why a person is pain, because they are violating something. It's now a matter to identify what it is they're violating and getting rid of that cause. I'm sorry, that was a long answer, but
awesome.
I can only speak from a scientific platform, and then
they're
put a
good
bit of
answers
the artistry of it.
They're awesome for me so far. Now, we'll shift gears a little bit, talking back pain. When often someone's told they've got back pain, I swear it's almost like the generic answer is you've got a weak core. Or glutes. Yeah, weak glutes or weak core. That's sort of the generic answer that you seem to get. Do you think does that fit in line? Like, is that a decent answer, or is that like just a terrible answer? Or what's your thoughts on that?
Well, the person who says that as the answer is falling into the trap of believing that all back pain has a common genesis. Very rarely it will be due to what you could call a weak core. But I think we have to be a little bit more masterful of that concept. It could be that they have inappropriate control. So they don't have enough. See, the body uses stiffness to control motion. And when you're under load, you have to control that motion, because if you get out of position, a tissue becomes stressed, and you become much closer to the biological tipping point where there will be micro trauma to that tissue, or macro trauma. So it's usually a movement flaw or a insufficient movement competency. Now, some people might interpret that as being weak, so you lose your position, and it may very well be, but generally speaking, there's a wisdom to control. And then I would actually place endurance. So let's separate strength into endurance, strength, and power. Now, when we get down to those subcategories, as the science shows, people, if you take a population, say, of automotive workers or miners or assembly workers in a factory, they're all doing the same job. It will turn out that those that have movement flaws and muscle endurance deficits are the first ones to get chronic back pain. And as we measured, they were all men, and they were chroming bumpers at the Chrysler car factory. And we measured who was getting back pain over time, and we measured how they moved, their strength, their endurance, their flexibility, their psychological profiles, and all these kinds of things. As it turned out, the strong ones were actually getting pain faster, because they would lift the 70-pound or 70-pound, that'd be 30-kilo car bumpers, but they would do fine for the first few lifts. But as they got tired, they broke form. And it was when they broke form. Think of when you've tweaked your back. It was when you got out of position. You know, there's all this trite now that posture doesn't matter. Really? You put someone out of position and load them, you will hurt their joint. Anyway, so it's the factory workers, when they got out of position, they would, so was that a strength deficit? Not really. It was an endurance deficit. They had the strength. It's just they couldn't control the good form. Now, the weaker men actually lifted with better form for more repetition.
Over and over and over again.
Yes, because they were only dealing with 30 kilos. However, when you get to real heavy loads, the weaker person, yes, those are the ones that are going to succumb. So do you see how we need a context to discuss we could argue these concepts many different ways, but we have to establish the context first to create a logical thought process to converge on the answer. And this is why people on Facebook and these other social media platforms, they're just designed to create controversy. Gone, it seems, are the days of mastery where people would sit down over a beer and you know, the good old Canadian and Australian way, and we'd sit down and we'd discuss logic and haggle it out, and by the end of the day, almost every one of these positions, there will be a time for it, and it's all context specific, depends on what's causing their pain. So
yeah, and I mean that's like you said, that's the balance as someone who's in like the fitness profession, is getting that right balance of whether it is the setup of the position because they're not setting up correctly because it's too light a load, or they're not paying attention to what they're doing, or whether it's the breakdown of form because it's just over time, the endurance. It's an interesting, there's no one size fit all answer for anything realistically, right?
Yeah. Can I tell you a quick little story that's a lot of fun? You know, sometimes I will be doing a podcast or putting on a course, and I'll start talking about elite athletic performance. And some of they tend to be more like the physio groups who don't really work like you and I in the pits with the big monsters. And they say, well, but the big monsters are irrelevant to us. And I say, no, you're not a master. Honda goes to the F1 racetrack to learn optimal performance, and they put that performance in the Honda Civic. I was at a hospital in Europe, and quite often they'll invite me over and they say, well, you see 3 patients in front of our surgeons and our fellows and whatnot. We just want to see how you assess. they brought up this older woman. She was about 70. Well, I'm getting close to that myself, so she wasn't that old, but anyway, she was about 70 and a bit frail. And I said, tell me what's going on. You know, she never mentioned her back pain. She started to cry. And she said, my physios have told me I have to go into a patient care facility. I have to leave my home. And I said, but why
70,
is
that's not
that?
very old, yeah, for that.
No, but she said, I said, why is that? She says, well, when I get off the toilet, they're afraid I'm going to fall. And I'm not afraid of falling. I'm not even afraid of dying. What I'm afraid of is no one will come by to feed my cat. Now, I've just learned a hell of a lot with that conversation. And I doubt anyone ever found out all of this from her before. But here's this poor woman having to leave her home because of some incompetent therapist has told her, you're going to fall, you better go in a patient care facility. Do you know what I did with her? I sat her on a stool, and then I got her to stand up, and she was about ready to fall. But I got her to stand up, and I said, sniff a little air, suck air in your lungs, become chest proud, be a peacock. And she loved this. And then I said, put your hands on your thighs. Now, this was in Europe. They didn't know baseball, but they knew cricket. And I said, go down like a cricket outfielder and put your hands on your knees and move your pelvis back and carry the weight down your arms. Now, shape your back. Stick your bum out, I said to her. She thought this was fun, but lift your tail, whatever language works.
All these external cues.
Yes.
I was just
And
writing something on cueing the other day,
and
yesterday.
she did it just, well, cueing, it's internal, it's external, it's verbal, it's auditory, it's your hands, it's whatever works. And so, yeah, I touched her in different places, and I said, carry weight down your arms. And she was falling back on her heels. And I said, now you're the leaning tower of Pisa. Lean forward through your ankles. Carry more weight down your arms. And I said, now you're stiff. All you have to do is just stand up, is pull your hips through. She pulled her hips through and slid her hands up her thighs in a perfect squat. Now, where did I get that? That is powerlifting 101. So I took what I knew from elite powerlifting and I applied it to a woman who was having to go to a patient care facility. And then she was up and down off that stool perfectly. And then this big smile came across her face. And I said, well, what's up with you? And she said, I don't have to leave my home, do I? And I said,
I can
no,
imagine
you don't.
that's such a great story, because the amount of times that even as a personal trainer, someone comes to see you after they've been to a doctor or they've been to a physio, and their first response, again, we know that there's no one size fit all, but their first response to these people is, we can't squat. You've got a little bit of knee pain, don't squat. And then our responses, like trainers, is always like, but how are you going to get out of bed in the morning? How are you going to get off the toilet? How are you going to do these things if you're never allowed to squat? You've got to, not squatting isn't the answer, because that's not going to lead to a healthy longevity of life, because you're going to end up in a facility. Even, obviously these aren't older people at this stage, but that story just highlights it so much that.
I often say this, and I think the honest people consider what I'm saying. Who has the potential to have the biggest influence on the lifelong health of an individual? Now think of that. It's the person who can coach them to move well. Every health system in their body depends on good movement. You can't argue with this. Not a diabetic pill, none of that. It's maintaining good, healthful movement below the tipping point over the lifespan. That is the biggest determinant of your health. And who owns that in the whole healthcare system?
Yeah.
You.
Yeah.
It ain't your brothers, I'm sorry.
It's a powerful message for the trainers listening. That is a powerful message, because
and along with that, yes, I do put it that way, and I'm very serious when I say that. The audience has the biggest potential to affect the health of the public. They better be bloody good at it.
Well, and go off and continue their education. I think this is one of the things that we pride ourselves on, is we're lucky enough to have been able to go off and continue our education over and going and attending conferences in Canada and the US and the UK and all these sort of places, and New Zealand. So that's really when we're trying to bring these things back to our audience as best as possible.
I know that. I got off on a rant because I know who I'm talking to.
Thank you very much. Now, I'd love to, again, we switch gears a few bits. I've got a few questions that I'd love to get through. The next one would be, you're sort of known with some of your work on doing planks, and I'd love to hear your thoughts for those people who are setting those Guinness World Records. I think it's like 8+ hours of planking, where I believe your research indicated, I think it's like a 15-second is sort of that area, that sweet point. I'd love to hear your thoughts on some of that stuff.
Okay, I need to start with a scientific foundation. May I talk for
Please.
2 or 3 minutes on that?
Yes,
and
of course.
establish a foundation, and then I can answer the plank question.
Love it.
Okay, the first foundation is the plank was designed to be a anterior torso stiffening tool that was very easy on the spine. So if you want to, I hate the word core stability, but that's what it creates. So now let me define stability. There's 3 critical elements to core stability. So consider our body as an articulated linkage. If I want to move my finger very quickly, I had to stiffen my wrist. So I had to create proximal stiffness to get a very quick motion. Now we can extend that through the whole body. If I want to get a really fast directional change, planting the foot, turning, I had to stiffen my core and explode the hip and external rotation, knee and extension, etc. If my core collapsed, I would leak energy. I would stress the tissues of my back under a loaded bend, and I would be very slow in that run and cut on the rugby field. So proximal stiffness enhances performance and it reduces spine stress. Let me give you another example. Am I on audio and video, or
yes,
just
yeah,
audio?
Yeah, I can see you. I can see you. Everyone can see you. Well,
all right.
They can either watch you or they can listen to you.
All right. So my big bench press muscle, pec major, crosses my ball and socket joint, and there's no coincidence that the core has a ball and socket at either end, the shoulders and the hips. So the pec major flexes the arm, but it does so distal to the ball and socket joints. That's what the athletic purpose is. But look what the same muscle does proximal to the joint. It bends my torso towards my shoulder. So if I was going to push you, I would not push very well because I collapse proximally and I get athleticism distally. However, if I now create proximal stiffness in the linkage, 100% of that pec major effort is now directed towards the athleticism, which is a distal push. So you see, to be in a combative athlete, a tennis player, a rugby player, every single type of athlete, with the exception of things like swimming. Now, they're different animals. However, every ground gravitationally based athlete and person living life needs proximal stability. So that's the first basic tenet that a lot of people don't quite understand. They'll say, oh, well, you have a flexible spine, it should be flexible. Well, wait a second. If you're going to dance, make love with your wife, all these kinds of things, it's nice to have a little bit of spinal flexion, but you better not use high load at the same time when you're in a deviated position. If you're then going to perform athletically or be on the construction site and lift a pail of wet cement, or you're going to deadlift your baby girl out of the crib at 2 o'clock in the morning,
over and over again.
of course, then your spine will require a certain amount of braced stiffness. Now, people get all hot under the collar about that one as well. I'm talking about tuning the brace to be appropriate for the task. Not too much, just enough. But if you're going to lift 500 kilos, it better be a lot. If you're lifting up your baby daughter, it is sufficient to control your core and unleash your hips. So anyway, what you created with the brace was a guy wire system. Now, no engineer would create a flexible rod and ask it to bear load because it will collapse, but that's your spine. So in order to pick up your baby girl out of the crib, you had to create a guy wire system. Well, when you assess the role of the anatomy of your core. You've got guy wires in the abdominals in the front, abdominals on the side, quadratus lumborum, the psoas in the back, multifidus, longissimus, iliocostalis, latissimus, etc. You've just created a perfect guy wire system, which is absolutely necessary. And by the way, I was one of the first, I think I was the first person to measure a joint buckling under load in a powerlifting situation in video fluoroscopy. This was back in the 1980s. The third critical element in our discussion of core stability is this. You can imagine if you let a little air out of your car tire, it now bulges on the road. And in fact, the car is a little sloppy on the road. But when it's full of air, it's firm on the road and it drives competitively. When people get a little bit of a back injury, an end plate failure, or a little bit of a disc bulge, the disc flattens ever so slightly. Now they get micro movements in their joints, set off like things like Palloff presses, for example. Or maybe throwing a ball now becomes painful, or rolling over in bed. If I say to a patient, do you ever get a sharp pain when you roll over in bed? I can promise you they have micro movements triggering pain in their back. But if they learn to, to mildly brace, they would control out that particular pain trigger. So that's the third critical element of core stability, is to control out the micro movements. So now with that background, I can answer your question about the plank.
That actually answered a bunch of different questions that I had as well. So that's good.
Okay, yeah, it's quite a story, but we were one of the first to actually put numbers on it and measure stability. Now, hollowing, which came from Australia, which you may be familiar with, which is drawing in your abdominals as an attempt. It was a little bit misinterpreted, I think. There was this idea that transverse abdominis was somehow linked to back pain, and it was an attempt to activate that muscle. As it turned out, it didn't really achieve.
So when you talk hollowing, do you mean like that hollow sort of rock position, that gymnastic style position?
No, it was for a bracing instruction, ask people to draw their abdominals into their spine. Please don't do that.
Okay.
Stiffen. In fact, push your fingers into the obliques and now push your fingers out. That is an abdominal brace. Now, I don't mean forward, I mean laterally. So that's the skill of an appropriate brace. And that's what athletes use to bulletproof their back if they're going to lift or throw or etc. So now let's get back to the plank. Well, they actually form 3 exercises because I've just described how the core stability mechanism involves muscles in the back, the sides, and the front. Well, to get the muscles in the front in a spine-conserving way, because if it wasn't spine-conserving, there's a chance a lot of people will cross the tipping point. So the exercise then becomes painful, poison. We don't want that. We want them to stay under the tipping point and create muscular challenge, but not challenge to the support tissues. That's the difference. So as it turns out, the plank produced a very nice ratio of challenge to the muscles, but it was still spine sparing, but it guaranteed a pattern that ensured stability. Well, then I went to Russia and learned, boy, the Russians are so clever and so advanced in performance progressions and exercise. Their sports science has been light years ahead for many years. Yes.
Would you say that's still the case now?
No, because we've learned all what they do now.
I was going to say, but through like the 80s and stuff like that.
Oh, they were magnificent in the 50s, 60s, 70s, and early 80s. Yeah, they were in their heyday. There's no question. But I can go back in history, and when I know we had a little discussion earlier about what we're going to talk about when we get to fascia, the stories I could tell you about what Russians knew in the 1800s. But we'll get to that later, hopefully, if I can shut up on this core stability.
Question, so that's all right.
Yeah, okay. But getting back to the plank, what I learned in Russia was the brilliance of creating endurance with never getting tired. So in Canada, we're heavily influenced by the US, obviously. And it's the American way that you build endurance by prolonging the task and getting tired, and you fight through it to build endurance. The Russians were more clever than that. They built endurance with short, repeated holds, so you never did get tired. So repeated 10-second holds.
And like that greasy groove.
Thank you. Pavel Satsulin is a,
You probably say the name better than I do.
well, he's a terrific friend of mine. I've
Oh,
learned
no
so
way.
much. Oh, absolutely. Yeah,
Wow.
he's where we get together as families. He's a fabulous mate,
Wow.
and we've. I hope he would say he's learned a lot from me, but I can absolutely say I've learned a lot from him.
He sits on
But
my idol pedestal as well.
and he should. A little fact that you might find interesting: Pavel is about my size, about 6 feet tall and 185 pounds. He has the strongest core I've ever measured. Now, I've measured world-class competitive strongmen, top heavyweight MMA fighters, Australian rugby players, as tough as they think they are. None of them have the core that Pavel has. Now,
Yeah,
how does
wow.
Pavel train his core?
Kettlebells.
Kettlebells, absolutely. He does landmine exercises, never on his knees, twisting his core. He locks his core and he spins around his hips and his ankles. But if he can underhook you, he will hip toss you through the wall across the room. He's got ungodly power. Or if he just does a roundhouse kick, he will just knock your legs out from underneath you and you're on your back on the ground. We've been at Santa Monica Beach just having a bit of a tussle. You cannot tussle with him because you're on your back immediately and there's nothing you can do about it.
Yeah.
It's so
I get it. Yeah, the old Sambo. The old
yeah,
Sambo
exactly.
champions.
Oh, you know your gear. Good for you.
Yeah.
Anyway,
Yeah.
so if a person has pain, what I learned in Russia is let's build endurance, but we can't afford to get them tired because the pain and the fragility of doing exercise, they develop back pain so quickly that they cannot tolerate it. So I learned what we called, in honor of the Russians, I called it the Russian descending pyramid. So they do 10-second holds of the plank, the side plank, and what we called the bird dog to make it tolerable. And slowly they would build up sets and reps in a descending pattern, all to stay below the tipping point. Now, that will not get you to the Olympics. Once they're out of pain, there's this myth, oh, Mcgill only ever does exercises for 10-second holds. Well, that's really only to get people out of pain. There's a context to all of this. Yeah. But for example, in my own training, every day I start with a 30-second plank, then I do a 25-second, a 20, a 15, a 10, and I drop it down in 5-second increments. I can tell you I've measured firefighters, police officers, NHL hockey players. Every NHL hockey player who we've ever measured who got a sportsman's hernia, that is a tear in the oblique muscles, none of them could do a 1-minute side plank. Now, we found a 1-minute side plank is very prophylactic for many types of injuries and performance deficits across the athletic spectrum. So that would be a minimum for an athletic training goal, shall we say. It bulletproofs a lot of injuries. So isn't that interesting? What the heck is a hockey player doing playing professional hockey who can't hold a side bridge 1 minute yet? You know, I'm an old man and I can hold it that long.
I mean, the forces, like the warding that you have, like to have to like keep stable. And I always say ice hockey. I lived in Canada briefly for like 2 ski seasons, and ice hockey's like my favorite international sport. I always say it's like playing golf on ice with skates on whilst someone's trying to knock your head off. it's such a great sport.
That's about it. Yeah, I went to the fights and a hockey game broke out.
Yeah, yeah, something like that. Yeah, not so much these days, right? Like, but it's it's like
in the old days,
like us over here with rugby as well. It's all been really well tidied up in regards.
Yeah, exactly. The culture has changed. But anyway, just to finish that off, I did some work with a very well-known Olympic rowing team, not Canada, who does produce very good rowers, as does Australia. But it was actually a rowing powerhouse, not either of those two countries. And I consulted with them through 2 Olympics. And they were having a good deal of back pain, which they dealt with. However, what I found in that was ratios now. So you want you know what a Bearing Sorensen hold is? So it's kind of like a glute ham raise. You strap the lower body onto a bench and then you cantilever through the hips, the upper body out, and you have to hold that for a length of time.
That's like the reverse hyper.
Exactly, but you just hold it isometrically now, so it becomes an orthopedic test. you gain much more resilience and you greatly decrease your chance of becoming a back-pained Olympic class rower if you can hold the Bering Sorensen back extension position 120% to 130% longer than the front plank. So now we're tuning.
Balance.
Exactly. So
Right.
now do you see I started out with 10-second holds, then I gave you some absolute values. Now I'm tuning it with ratios front to back. So for men in particular, you should always have about another 30% dominance on the back side of your core versus the front side of the core. Now let's talk right to left side for side planks. I also know from the Olympic rowing
Am I allowed
experience.
to guess who that country was?
No, you're not.
Okay.
No, I'm sorry. No, this is all, you know, for medical information, we don't discuss patients' names,
Right.
nor do I discuss athletes, teams, or countries. I'm sorry.
No, that's all right.
However, I can tell you from the Olympic experience that if the right side plank is different from the left side plank by 15%, you've greatly increased your chance of developing back pain. Now, I can tell you that that is quite a universal number. I've measured it in student populations, populations of combative athletes and whatnot. You want to be, if you have a deficit more than 15%, you want to address that as a trainer. So now we're tuning the core. But
Yeah,
you know, this never ends. It just goes on and on, this
you're
discussion.
like funneling in, right? That's I think those ratios are super interesting because I have to say it's not something I've ever thought about in that. I mean, I always say that people don't work their posterior chain enough.
Right.
I've always said that, right? But I've never thought about it going like, well, if you can hold a plank for X amount of time, you should be able to hold this for X amount longer. That's never gone into my head. But that's
Right. Well,
interesting.
these ratios are in my Ultimate Back Fitness and Performance book. So there's the Russian influence coming out. They were very quantitative, and they
Yes.
had all kinds of ratios. And, you know, their studies these days wouldn't cut the mustard because some statistics Nazi now would say, who's never worked with an athlete, oh, that's not statistically significant. Are you kidding? They just had 3 gold medal Olympians, and here are their scores. That's bloody significant. I want to know where they are.
To be that top of the spear, to be the top of the spear there, like to be a gold medalist, firstly you got to get through the rest of the Russians to get there. It's like the Cuban wrestling team, right? Firstly, you got to get through all of them to get there, and then on top of that, you got to get through the rest of the world, who's gone through the rest of their people to get there. So they're fairly significant numbers, you know. Like,
well, I'm retired from
individuals are fairly significant.
Yeah, I'm retired from the university now, and I got really fed up towards the end of it, where people reviewing science would say, "Well, this isn't significant because you didn't have 30 numbers." And I said, "Look, I've just measured the fastest man in the world. Don't you think that's an interesting case study?" And it just didn't fit their thought pattern. And I said, okay, well, to hell with this. I'm going to study the fastest and the best and learn what it is they do. So there was a little bit of a
top
break
1%, right? Not even that top 0.01%.
Well, that top 0.01% helped me understand the bottom 0.101% because they were both dancing on a knife edge. You cannot make a mistake.
The car analogy was a great analogy.
Yeah, you can't make a mistake with a high-level athlete and cross the tipping point, just like you can't make a mistake with a very fragile person. If they sneeze, they've got an onset of acute back pain. So, you know, it's precision craft mastery at both ends of the spectrum. Anyway, sorry, I spoke too long.
No, that was awesome. I mean, you answered a couple of my questions. I think before we get into the fascia one, I think you answered my plank. I'm guessing your big 3 movements would be the plank, the side plank, and the bird dog exercise.
Yes.
For core strength, core, fixing up a lot of things. Yeah. Now, the next one
that's just the beginning to get them out of pain. Of course,
yes.
That's not going to take them to the Olympics. But if you're dealing with back pained person, that's a pretty good place to start.
And then also that's interesting that you said the ratios. I think that's also an interesting thing to talk about is going like, if someone's side plank, left side, right side is significantly different, that's something you need to be paying attention to. And I think also for trainers, I think that that percentage of what was the hold you called it a what? I hadn't heard of that.
Bering Sorensen is the
Baron
extensor hold. And
Sorensen.
I
Okay.
might say, since your audience is basically professional trainers, if you do a 6 to 8 week correction of training the weak side, you don't need to train the strong side. It will not get weaker. So there you go. We also know that if you just focus on the weak side for 6 weeks, you will bring it up to within the acceptable ratio, and you won't lose anything off the stronger side, or the more endurable side, to be more precise.
That's also an
So
interesting
there's another little,
phrase.
these are the things, the little nuances of the craft mastery that we try and teach in our courses. That,
which I'll touch on. We'll touch on
yeah,
that when we get towards the end. I actually got
yeah.
one of your you're coming to Australia soon, and I actually got targeted with one of your ads actually, which was interesting.
Oh, nice.
We could
Okay.
do
I
some
don't know
of those
anything
ads.
about social media,
Yeah,
so apparently whoever does that is doing a good job.
they were. So now, then I want to go back to that fascia, and I'd love to hear what you spoke about I think you said the 18. Did you say the 1800s in Russia?
Yeah. And again with Pavel, I mean, what he knows about fascia, he doesn't know about fascia, but his techniques are so clever in optimizing the fascia that he knows what works. Or have you ever heard of Bill Kazmaier, World's Strongest Man?
Bill Kazmaier, not specifically.
Yeah.
No.
Well, you've heard of the World's Strongest Man
Of course.
competition.
Yes. Yeah.
Yes. Well, the first 3 years it was won by an American named Bill Kazmaier.
Okay.
And I've known Bill for years, and I would study his training because, once again, I wanted to know how the strongest man in the world trained his back. And he would do all kinds of things that were so clever. Well, interestingly enough, we were at a conference last year, SWIS, the Society for Weight Training Injury Specialists. And I was invited to come up. This was all kind of unbeknownst to me. And they said, and now we'd like to present an award for a lifetime achievement. And they called my name. I was astounded. So I go up there, and then they give me a note. Would you introduce the next winner of the Lifetime Achievement Award? And at that point, I looked down at the name, and honestly, I got a lump in my throat, and tears came to my eyes, and I could hardly speak. My knees just went limp. It was Bill Kazmaier. So, and it said, tell a little bit of a story. Well, here I thought, well, this is a dirty trick. I'm on a podium. I'm emotionally distraught. And now I have to introduce one of my best buddies and heroes, Bill Kazmaier, to come up, and I'm supposed to present the award to him. And now I've got to come up with a story.
I think even that little bit there would have been good enough.
Well, the story was this. I had studied Bill, say, even 20 years before this, and what he used to do to create basically the strongest back in the world. And I would ask him later, I said, Bill, how did you know all of this? Because I knew it from our science. It was the only way it could possibly be. And yet when I watched you train, you did it. How did you know? And he said, Stu, I only know what worked. And I thought, isn't that brilliant? The person who, unbeknownst to them, was training in a way incorporating the science, and they proved it in spades with real life validity. And here was a little pencil-necked professor like myself figuring it out, saying, yes, this is what you must do. Anyway, that was my introduction to his award, and we've been, it's just wonderful to meet with him and talk about some of these things. Of course, we have a laugh about it now. But anyway, now it was a bit of a sidebar, but you want to talk about fascia?
Love to.
Okay. Have you heard of a name, Bill Parisi? He's an American, and he runs the Parisi Speed School in
yes, I have actually.
the U.S.
That now I do, yes. The speed,
all right,
speed is the bit that worked.
Right. So he trains people to run fast.
Mm-hmm.
Well, when you really, and again, Bill is another wonderful friend of mine. And when you realize what Bill really does is he takes kids and he gives them self-esteem. That's what he really does, which is just fabulous. And he uses athletics and speed to do it. And he'll take any kid and make them faster by teaching them running mechanics and appropriate diet and teaching them about, but he does all kinds of things. Again, unbeknownst to him, he incorporates the fascia because a speed demon is an elastic animal. So a cheetah is a highly elastic animal. They store and recover in springs. You may have heard of Dan John in the US. Oh, so another friend of mine, Dan John. Dan is brilliant because he takes our science.
I'd love to go to one of your dinner parties, by the way.
Dan takes what, see, I sometimes have difficulty explaining things very simply, but Dan does. He says, Stu, what you're saying is this: I can push someone, that's an ordinary push, or we can turn them into an athlete, and bam, that's an athlete. So you load the spring and then you let it go. And I said, brilliant, Dan, that's it. That's the hammer and the stone that I've been trying to get across. So he just is able to coach it immediately. But
he's a fantastic coach.
He is. He's brilliant. But there is a fascial spring loaded, and now I tension it up with a little bit of muscle tone and I unleash it. So I'm going to tell another story now on composite materials.
Please.
In World War II, they were having problems building aircraft because they would fall apart. They were built of wires and wooden struts. And the wires could bear tension, but they would collapse. Obviously, you can't push a rope. They would collapse if they were made to bear compression. So the engineers had to get the airplanes right. The wires bore tension, the struts bore compression. But then they were cracking and fatiguing. So they built them with heavier wood, and then they couldn't fly. They were too heavy. So they invented plywood. Now, plywood is a mechanical composite. So they use much less material. You can take a board and measure its strength and stiffness, then take the same board and slice it into thin layers and then glue the layers back together again, but you put a cross ply. The grain runs this way and then that way, etc. Now, you take that same board and then you take the piece of plywood. The plywood is much stiffer and it is much stronger. So now you've created a super strong and a super stiff composite material. Now, this is the brilliance of the body. If I shook your hand and squeezed you as hard as I can with my hand and my forearm, you would feel the strength. But if I then, if we were in the same room as Pavel Tsatsouline, he would teach you to grip the floor like a monkey with your toes and your heels. Stiffen your legs, harden your glutes, core compression. Tension. Exactly. Take 70% air in your lungs and compress down. Harden your neck. Push the tongue hard to the roof of the mouth. Grimace with your offhand. Squeeze it. 90 degree at the elbow. Then apply the same grip force, and you will see a world of difference. What he did was he just turned your body into a mechanical composite. So fascia is the material that turns all your muscles into one. They eliminate agonists and antagonists. Fascia makes every muscle in your body an agonist to the goal if it's organized with good coaching and good technique. It's, again, have you been hearing this stuff in Australia, that technique doesn't matter and posture doesn't matter? And it's astounding, the science that seems to be left on the wayside here. But no, absolutely, you build a composite, and then to feel, it's fun when I get to work with, say, an MMA athlete. I like a little roll in the cage or whatever, and they only go 5% with me. But I want to feel the brilliance of their athletic techniques, and they are just boa constrictors through their fascia and organizing all of their muscles to the effort. And anyway, there's a start on fascia. Then we could have a discussion on mobility. So we measured, there was a brilliant Czechoslovakian neurologist named Vladimir Janda. You may have heard of Janda exercises and whatnot in back pain. And one of Janda's premises was chronic hip and back pain shuts off your gluteals. In other words, it inhibits or weakens your glutes. He used the words weak, but the actual word is called neurogenic inhibition. Now, we proved that. Some people, when you give them chronic pain, the brain inhibits the neural drive to the gluteals. That's a fact. Not in everybody, but in some. So when you say they need posterior chain strengthening, I would start with re-education to get the brain connected with those muscles, then go ahead and train it. But on the anterior side, he used to talk about the hip flexors become tight. Well, we defined it a little bit more tightly than that. It's not rectus femoris iliacus, it's actually psoas. Psoas proper and psoas distinctly becomes neurogenically facilitated. It becomes tight. So a trainer might say to a client, well, you sit for 8 hours a day, we're going to stretch your psoas muscle, which is all good stuff. But how do you stretch a psoas muscle? Well, they might do a lunge. But now here's the story of fascia. There is an anatomical train. If you listen to Tom Myers, he's proven anatomically, but I can prove it neurologically and from pure mechanics. You can see my hand. I'm just going to internally, externally rotate my hand. I'm going to put it over my shoulder. Now I'm going to take a standing. I just went for a bicycle ride, so I'm still in my cycling shorts here, but forgive me. Anyway, so now I go overhead and I'm doing a stretch through psoas, and I don't feel anything on my psoas. And for your trainers, your psoas is, there's rectus femoris below the inguinal crease. If I drift medially inside of rectus femoris, I will go to the iliopectineal notch. Now I'm right on psoas tendon. So when I feel psoas tendon and I do a lunge, I'm not feeling any strain in psoas until I spin my hand around like that. Now I'm changing the fascial tension through the anterior sling, through the pec, down the abdominis to psoas. And you will feel, not everybody, but someone who has highly integrated fascia will feel the psoas tension. And in some people, they will actually go to pain. So isn't it interesting that even the science of stretching, it really matters for some people how you organize the fascia. I remember working with a great Polish Olympian, and I can use his name because it's quite public, Jerzy Gregorek. He holds 3 world records in Olympic weightlifting. But when I watched him stretch and how he organizes his wrist for stretching his glutes and all, and you know, it all just comes back. The Poles, the Russians, the Bulgarians only ever had 2 or 3 subjects in their studies, so they never would have been published in the American system with their so-called statistical rigor. And yet the statistical rigor prevented all that science from coming to light. So I had to really learn it from the Russians that were far more creative and experimental.
Yeah, I mean, it's incredibly fascinating because, like you said, they were just so far ahead of their time in throughout those years of like the 50s through to the 80s. Obviously, there's certain other things they were doing at some of those points, but regardless, their performance was, you know, unbeatable in a lot of things.
You know, it's so fun when the Russians started to come over to play NHL hockey. And the stories I could tell working with some of the NHL teams. You know, I remember one team, they called me in to look at a few of their back pained players, and you know, if someone had back pain and they couldn't play for a while, the trainer would say, oh, well, you ride a bike for a while so you don't lose your aerobic capacity. And I remember one of the brilliant Russians, if you're a hockey fan, you'd know this guy, so I can't mention his name, but they said, oh, you should ride a bike while you're in back rehab. And he said, when they put bike on ice, I ride bike. I don't
I've heard
ride
that
bike.
story. I've heard that story.
Okay, well,
I'm
I've
sure
told
I've
it
heard
before.
something similar to that story about like
Well, I've mentioned it in other podcasts, but anyway, there you go. And he knew that he would ruin his explosive power because hockey players are 45-second anaerobic monsters. They go like hell for 45 seconds. They sit on the bench for 2 or 3 minutes and get their, you know, baseline back, and then off they go again. They do not want to ride a bike and become endurable.
Very similar story. I don't know whether it was a hockey player, but I feel like it was a rugby player who had a very similar story where they're like, oh, you need to go and ride the bike. And he's like, I don't need to ride a bike. I don't ride a
Yeah,
bike at all. I need to get on the field and do whatever I'm doing on the field. It's a
exactly. Yeah, you
very
don't
similar
want
story.
the metabolic systems to compete. And the Russians were brilliant at this. But anyway, there's that little bit of a story that.
Well, thank you very much. I mean, we've probably gone potentially, longer than maybe you'd anticipated, maybe, but it's been pretty amazing. I've got. Um,
Travis, I've had a ball.
Thank
Your
you. Me too.
questions are fabulous. Your questions and
I
follow
do
up are
have
fabulous.
probably one more potentially. It might venture out to more. The Currently, I'm a primary school teacher as well, right? So I'm not actively teaching anymore, but as a primary school teacher, one of the things I see, and I think society in general currently, is technology. And you get this, I don't know if you this sort of habit happening, which obviously can't be great for necks and backs. Have you found working clinically currently a change in the last 10 years or whatever time period based on the influx of like mobile phone usage or just technology in general? Have you found things are changing, or it's just same as usual?
The answer is I've found great changes, although I'm not going to say specifically phones because I remember 20 years ago people were down in newspapers like this for hours on
Good
end as
point.
well. So I'm not going to blame that, but I was on campus obviously for 40 years of my life. And I can also say that every incoming class that we had, we would do various tests in the labs to give them measurement skills. We also tracked those scores of those students. So when I started as a professor, computers hadn't been invented yet. Young folks will find this hard to believe. But the personal computer really started to get going in the 90s. It was at that time we saw this dramatic loss of general fitness in incoming students, and we saw their weight climb, and we saw their gait patterns change. They went from walking elastic machines to waddling bags. They waddled. They flip their feet forward and land on their heels as if they're walking in flip-flops. They lock their knees as if that's an obese person's pattern, to lock their knees so they can take the weight instead of having a bit of
Stability.
bounce in their knee.
Yeah.
It was an astounding shift that I saw, and I relate that to several societal monumental shifts. The first one was the personal computer. The second one was this idea that the world is dangerous, so now moms drive their kiddies to school. We never were driven to school. We had to go to school. When we got home, we did heavy labor. And the worst thing, when I look at the ability for a woman to build bone to prevent osteoporosis later in life, the biggest opportunity they have is when they're 14 and 15 years of age. That determines their bone mass for the rest of their life. And what did their
Wow.
mothers do? Stole their bone mass by driving them to school instead of letting them compete in good, challenging sport and walking a good distance to school, carrying a heavy backpack. I mean, I was interviewed on our national radio a little while ago. I think it was a chiropractor who was saying, "Oh, it's terrible, all these little kiddies walking to school with these backpacks on their back. It's giving them back pain." And I said, "Well, we just call that training." But,
Well, I mean, yeah, like that's a Dan John classic, carrying things, right?
yeah. But anyway, so I don't think cell phones have helped any. And socially, I worry much more. We now have a leader of the elephant of a country who lives right beneath us, who now has illustrated to the world that science doesn't matter anymore. Scientific debate consists of personal attacks on the person that you're having a conversation with, and that's okay. This is what I fear.
Mm.
Not to mention this, I mean, basically the planet's on fire, and I don't think we have too much more opportunity before we have to have a mammoth international effort. Otherwise, we're done. So these are the big things. I'm not going to blame any single one of them, but those were shifts that I saw through my career. But people are soft, and using a Dan John euphemism, make yourself hard to kill. Well, when you think of athletes who get too strong and too stiff and too slow, they're easy to kill. Get ones who are too weak, they're easy to kill. The average university student on campus now is very easy to kill. So it's a bit dramatic, but that's how I feel.
Well, I think even my experience as a primary teacher, kids coming through, like the skills and the abilities and just the understanding of doing things. I think it comes from the parents as well. I think combination of factors, parents having lack of time, lack of knowledge, because the way the parents were brought up, and it just trickles down and it gets further and further. I think one of the big things is like that lack of struggle. Like as a parent, they typically want their kids to struggle less. And like my grandparents went through World War II prison of war camp, so they didn't want their kids to go through the same thing. My dad was born in a tent sort of situation, and then things gradually get easier as they go through, and it's that trickle effect of life becoming easier and softer, so to speak. So it's an interesting thought of like, it's not just because you're right, like it's you with the phones, not just if you've been in your phone, people were in books, people were in newspapers, same positions, and it's that right. I've never thought about that like that. That's a very astute point.
Anyway, our job as people to influence physical exposure and getting the exposure right is probably about the most important modulator of global health.
Yeah,
that's a pretty strong statement.
That's a good statement to get to the finish point of today, I think. And what I want to finish off on is, if people want to know more about, I don't know if you know your upcoming dates off the top of your head here in Australia, or if you want to let us know your books and all this sort of stuff, I'd love to give everyone the opportunity to jump on board.
Well, thank you very much for that, Travis. We are coming and putting on a 4-day summit course, which the first 2 days is the foundation. How does the spine work? What are the pathways to pain? What are the determinants of athleticism in a spine-centric view? So that's the first 2 days. The third day is, how do you assess the mechanisms of back pain with precision? And the fourth day is, all right, now what do you do about it? We're out of pain, let's build some performance. We're doing that in Melbourne, or I know the Aussies say Melbourne. My daughter's lived in Australia she says, Dad, it's Melbourne. Yeah, so let me see now. In Melbourne, we are there January 30th to February the 2nd. We're in Sydney doing it all over again for 4 days, February the 7th to 10th. But if folks go to backfitpro.com and look under our courses, they'll see them there. And I know we get asked to go to New Zealand a lot. I know you have a great influence in New Zealand. So we're not going to make New Zealand, but with your listenership, come across the ditch. If they want to come across the ditch. And I was surprised. It's a good 3.5 hours to come across the ditch. It's bigger than a ditch, isn't it?
Well, it's closer for me to go to New Zealand than it is for me to go to Perth.
Yes, that's true. Very true. Just like it's easier for me to go to Florida than it is to go to Vancouver.
You're Toronto or thereabouts?
I'm north of Toronto. I'm a few hours north of Toronto.
Yeah, beautiful. Yeah, so yeah. I mean, now just to clarify, I know that obviously you'll get clinicians going to your conferences, but fitness professionals, personal trainers, perfect for those guys as well?
Absolutely it is, yeah.
Beautiful.
Yeah. I've made the pitch. They are the ones who have the biggest ability to determine back health and the other elements of health that we were discussing. They better be masters of the craft. No
Sounds
excuses.
Great to me. All right. Well, thank you very much. Bear with me 1 second. Sorry. Thank you very much for today. It's been a great pleasure. Like I said, you're probably one of my most referenced people, and you dropped a bunch of names in there that as I said, I'd love to come to a dinner party with some of those names, because they're also in the reference list of, like, when I reference people. You basically, like, ticked off all my reference lists of people in the fitness industry.
Oh,
So
I hope
thank you
there's a
very
few
much.
more in there.
Thank you very much. It's
Yeah.
been a
Anyway,
pleasure.
yeah, Travis, thank you once again for all you do. It's so important to provide the forum and get this knowledge out there. I hope to meet you when we're in Oz.
Yeah, well, that time of year is not too bad, actually. It's that sort of time, January through February, we've got a bit of time to figure that out. I think we could be good. I think, as I said,
Fabulous.
I got targeted with the ad, so I know whoever's looking after it is on top of it. So it's good.
Fabulous. Okay.
All right,
I'll
beautiful.
pass that on.
Thank you very
Well,
much for your
thank you so
time.
much. Nice meeting you. And
Pleasure.
I wish you all the best with fatherhood.
Cheers. Thank you. All right, thank you for your time.
Bye now.